in their states. The average American on ACA could see their costs double, even triple. And that's in red states, that's in blue states, that's in every state. I just talked about a person in the North Country, Stefanik's district, who now pays $2,800 for health care. They'll have to pay $20,000. What is a family going to do when they see that to have health care, to keep their health care insurance, they got to come up with $20,000? What do they do? What do they tell their children? That they can't go to the doctors they've been seeing? What do they do if someone has cancer and is cut off from treatment? What do they do if their hospital closes and another hospital's 100 miles away and they can't get to their doctors? So the American people are facing one of the most devastating crises they have faced in terms of cost, and we still have not heard crickets out of any negotiation with Johnson or with Thune.
How does a family choose between health care and survival? Between medical bills and groceries? Do parents skip their own medication just to pay for their child's doctor visit? These aren't exaggerated questions. This is the kind of emotional and financial pressure that real people are about to face. And here's where the outrage builds. This policy shift isn't being discussed with those families in mind. It's being debated in clean press rooms and polished podiums, while ordinary people are left wondering how they'll afford a single doctor's appointment. This is where the tension becomes explosive. Democrats argue that health care isn't just a number in a budget, it's a lifeline, a guarantee that if your child gets sick at 2 a.m., you won't have to choose between the hospital and the rent. Republicans, however, are pushing a plan that cuts major healthcare support systems in the name of fiscal control and spending discipline. But ask yourself, what good is a balanced budget if people can't afford to stay alive?
The problem is Republicans aren't serious as it relates to solving the affordable healthcare crisis that they've created, solving the cost of living crisis that they've made worse. As Democrats, we've made clear, we will sit down anytime, any place with anyone to find a bipartisan path forward to reopening the government, standing by our hardworking federal civil servants, enacting a spending agreement that actually makes life better for the American people, and decisively addressing the Republican health care crisis, which is devastating everyday Americans all across the country.
Imagine a patient halfway through chemotherapy suddenly told, "We can't continue your treatment. Funding has been cut." What do they do next? Drive 100 miles to the nearest open facility? Hope they can find a doctor willing to take them? And what about families without cars, without savings, living paycheck to paycheck? Do they just wait and hope their condition doesn't get worse? Can a shutdown justify putting lives on hold like this? This is not just a political standoff. It's a direct hit on healthcare access, medical research, and emergency response systems. Hospitals don't just treat patients. They employ thousands, support local economies, and act as emergency lifelines during crises. If those doors close, even temporarily, the consequences ripple through entire communities.
The kid has cancer, and the treatment has been cut off, the research has been cut off. We are fighting for the American people. The Republicans can talk all the political stuff they want. We're on the side of the American people because they need help.
From the very beginning of this crisis, Senate Democrats and House Democrats have made clear we are fighting to address the health care crisis that Republicans have created, the largest cut to Medicaid in American history, as part of the Republican One Big Ugly Bill that hurts everyday Americans in order to benefit their billionaire donors with massive tax breaks. Hospitals, nursing homes, and community-based health centers are closing all across America because of Republican policies. That's hurting everyday Americans. Their refusal to extend the Affordable Care Act tax credits is going to result in tens of millions of people in Republican-held states, Democratic states, purple states, all across the country. It doesn't matter. Tens of millions of people are going to experience dramatically increased premiums, co-pays, and deductibles.
Think about that pattern. If a policy is rejected once, maybe it needs tweaking. If it's rejected 5 times, maybe it needs serious revision. But 10 times? At that point, This no longer looks like policymaking, it starts to look like political stubbornness. Viewers, what message does that send to the American people? That leaders would rather repeat a losing strategy than sit down and craft a bipartisan solution? This is where the clash becomes deeper than just budgets and numbers. It turns into a battle of political ego versus public need. Republicans want to appear firm, refusing to back down. Democrats want to appear as defenders of healthcare access. And caught in the middle is a nation waiting for leadership, not theatrics. Here's a powerful question for anyone watching. If a bill keeps failing, who is it really serving? The people or the politics? Because let's be clear, if the public supported these healthcare cuts, the bill would have passed by now. The resistance is strong because the consequences are devastating and voters know it. But here's where it gets more dramatic. Republicans are not just facing opposition from Democrats. According to Democratic leaders, even some Republicans are feeling the pressure from their own districts. They're starting to squirm, as Hakeem Jeffries put it. Why? Because constituents are now realizing what these healthcare cuts mean for their own lives, their hospitals, and their insurance costs. Public outcry is building. Lawmakers are being questioned at town halls. Phones in congressional offices are ringing. And every failed vote increases the spotlight on those who keep pushing a plan that Americans clearly do not want.
It's going to make healthcare unaffordable for people. They will be unable to see their doctor or take their children to see a doctor when they need one. That's not acceptable in this country. This is the wealthiest country in the history of the world. So Democrats are standing up to address the cost of living crisis that Republican policies like the Trump tariffs have made worse. And we're standing up in defense of the health care of the American people.